We've been hearing a lot about flattening the curves, and we need to flatten curves as soon as possible. We also need to prevent curves. And what I mean by preventing curves is not only the return of the virus, but the emergence of suicide and the emergence of conditions that are highly associated with suicide, like depression and like alcohol-related problems. We not only need a biomedical approach to this virus, we need to have an economic strategy, a work strategy, and a mental health strategy, and that all goes together.
In the long term, how will the physical isolation and economic insecurity resulting from the coronavirus outbreak impact mental health? What can be done to mitigate these effects? What should governments do? What lessons can be drawn from the Great Depression, the 2008 Great Recession, and the 1918 Spanish flu pandemic? And why do people in lower socioeconomic strata appear to be disproportionately affected by COVID-19? In this episode, we sit down with Dr. Roger McIntyre, a professor of psychiatry and pharmacology at the University of Toronto, who heads the Mood Disorders Psychopharmacology Unit in Toronto's University Health Network. This is American Thought Leaders, and I'm Jan Jekielek. Dr. Roger McIntyre, so great to have you on American Thought Leaders.
Thanks for having me. What a pleasure.
And it's also great to actually have a fellow Canadian from my hometown, Toronto, as well.
Especially nice. That's very nice. So, the brain drain went to the U.S., but hey, look, we can still connect through technology.
So, you wrote a paper recently that's actually about to be published, which speaks to something that's really been on my mind and on the minds of a lot of our viewers. Your paper is titled Projected Increases in Suicide as a Consequence of COVID-19. Now, the question on everybody's mind, I see this, across social media, I'm talking about it with people and so forth. We have essentially shut down the economies of most free countries at the moment, and of course beyond that, to deal with COVID-19 or CCP virus as we call it. Now, the question on people's minds is, could it be that the cure is worse than the disease? Because there's all these sorts of social impacts that are happening. There's the highest unemployment numbers in memory in the US, for example. And of course, there's a lot of consequences of that. That's why your paper caught my eye. Tell me what you're thinking.
Well, it's a process of thinking, a thought process that's really been in place for quite a while. It's something I've reflected on for, frankly, a couple of decades. That being the relationship between economics and brain health broadly, but more specifically suicide. And maybe I'll sort of really narrow it down a little bit. We know from many, many lines of research conducted, frankly, for decades, that the relationship between social determinants broadly, which includes aspects of macroeconomic, and general well-being, medical illness, and mental illness is a bit of a mixed relationship. And I can say this as an academic. Academics like to carve their little niche, and people talk to certain issues and certain relationships. And taken together, in summary, what we can say is that the relationship between economics, more specifically changes in economics, that is, a recession or a depression, and physical health, like heart disease or diabetes, respiratory diseases, that's a bit of a mixed relationship. And that's a long conversation that is wonderful for the tutorial class at the university for a 3-hour in-depth discussion. But where the relationship is unequivocal is the relationship between economic hardship and suicide. Now, suicide is not a mental disorder. Suicide is an act. Obviously, it's an act that is horrific for the families and people around these people and so on. And it's an act that serves as a proxy of mental distress. In other words, the great majority, more than 85% of people who commit suicide have a diagnosable mental disorder. And the COVID-19 reaction, that is the calls globally for isolation. We call it social isolation. Maybe we should be calling it more physical distancing. But nonetheless, this social isolation, the quarantine, which is a different concept than social isolation, and the stay at home and don't go to work is, in my view, the biggest assault on mental health ever recorded. And I say it for a couple of reasons. First is we have many factors here that really form a, frankly, horrifying combustible myth. We have unemployment. Now we're seeing the unemployment numbers changing on a weekly basis. In the month of March and early April, up to now 16 million people have applied for unemployment. We've heard from the Labor Bureau a contraction of the labor market already. This alone is disquieting. Along with that, you have economic insecurity. You've got job security, economic insecurity. Those are overlapping but different. All the while, we're asking people to stay at home, to be quarantined. Now, when we take an approach to this, history as lesson approach, that is, we go to the financial crisis of 10, 12 years ago, the so-called Great Recession, the Asian financial crisis in 97, 98, and of course, the Great Depression back in the late 1920s. There's lots that we can learn. First, what we can learn is that unemployment as an indicator of, as a macroeconomic indicator, et cetera, is powerfully associated with suicide. And this has been described by epidemiologists, by sociologists, by psychiatrists. It is a well-accepted and well-established relationship. Let's bring it closer to today, the Great Recession. The Great Recession in the United States saw an increase between roughly 2007 and 2009, about 4 percentage points increase in the overall unemployment rate, about 4%. We'll round it off. What was observed during that time is that there was an increase in suicide of a similar percentage. A 1% increase in unemployment was associated with a 1% increase in suicide. Now, if we go across to Europe, which I think is an interesting laboratory because there's many different economies in Europe, they were affected by the Great Recession. And because of political regimes in place, some governments had different types of approaches to this. Some were very liberal, neoliberal. Others were more sort of austerity and more conservative. And there were different approaches. And it provided us an opportunity to look at various relationships. But to keep with this theme of unemployment and suicide, they also observed in Europe, across many countries, an increase of about 1% in the unemployment correlates with an increase of 1% in suicide. So we've got, in fact, European and we've got North American data because Canada was also included. So when I, in fact, woke up, as we all did a few weeks ago, to this pandemic, and we saw what was happening very quickly, and then we have projection rate, Janet Yellen recently saying she thinks it's going to be about 13%. We have Miguel Castro from the St. Louis Fed last week reported up as high as 35% unemployment rate. Whatever that percentage is, we don't know, but it's going to be very significant. And this is from a starting point of 4%, or just less than 4%. So taken together, we can expect a significant increase in suicide. Now, as I've watched the governmental approach to this, I think there's been areas of strength to how they've handled this in terms of communication, and we can discuss to what degree the communication has been clear, but there's been communication. There's also been an effort to provide services at the point of care, et cetera, and that's, of course, warranted. What I'm concerned about is what economists call externalities and the negative externalities. Because this isn't just a biomedical threat. This is an economics threat and a mental health threat. And we've just completed the analysis that you made reference to, which is now in press, and we went with different assumptions. Unfortunately, in the United States, as you know, the increase in suicide that really took a lot of, it really accelerated during the recession, didn't slow down. It kept going up and up and up. We've seen an increase in suicide of 30% in the last 15, 20 years in the US. So we took data from the Department of Labor. We had suicide statistics from the Centers for Disease Control. And we built into a model certain assumptions about trends and so on. And we went with two different models. What would be the increase in suicide if the unemployment rate is 5 to 10% versus, for example, 15 to 20%? And what we found was very concerning and in keeping with the model. That is, with a 1% increase in unemployment, there's a 1% increase in suicide for the first 5 to 7 percentage points. And then it begins to be about 0.9 1% goes to zero point 0.9, and then 0.8, 0.7. So you start to see it kind of leveling off. But this translates into deaths of up as high as 8 to 10,000 excess deaths due to suicide. And for me, I've been very concerned about the unintended consequence of that, because that is the economics and that is the mental health part, which has not been part of the conversation, at least not for most people, but some of the politicians and some of the officials are speaking to it. And it's what provided the impetus for us to do this analysis.
Now that's extremely fascinating. I mean, and of course, it immediately begets the question I'm going to ask you right away. You're obviously also thinking about, mitigation, I guess what you would call mitigation, but how to deal with this, right? And deal with it. Is there a way to deal with this? Because probably it'll be true to some extent, at least, whether or not the projections are exactly right, while people are still isolated. Are there things that can be done while people are still isolated?
Well, that's a key part. The isolation piece is a key part. At the end of the day, we will need an exit strategy. People will need to return back to their lives. Quarantine in and of itself is a hazard to brain function. Let me just give you an example of that. In Toronto, we were the city most affected outside of Asia by the SARS epidemic back in 2003. We had 44 people in Toronto who lost their lives because of SARS. And one of the learnings from the SARS experience was that, yes, this was a stress, clearly for people, especially frontline workers, as we're seeing today. But quarantine in and of itself is a stressor. And quarantine in and of itself predicted whether people went on to have problems like depression or post-traumatic stress or started to abuse alcohol. So the quarantine part, we're going to have to deal with very thoughtfully. The notion just stay at home and then we'll get back to you later, that doesn't resonate well with brain function. And the literature in animal science and in human science shows that if we have a chronic stressor, that is bad for our mental and physical health. If we have a chronic stressor that's unpredictable, that's worse. So we need to have an exit strategy, a clear exit strategy for no other reason than for mental health. Now, we have learned from the experience, again, to go back to the Great Depression. So in the 1930s, New Deal spending increased. We all know the New Deal, it increased. And some very careful analysis that were done revealed that those cities that spent the most in the 1930s on welfare programs, wage subsidy, unemployment, and indeed healthcare, those cities had the lowest suicide rates. In Japan, during the Great Recession, for every 1% increase in GDP spending on healthcare and social services, there was a commensurate decrease in suicide of about 0.2%. And this was also seen in Europe. It's been replicated. Now, spending money is not the solution. Spending money thoughtfully on, as I said, wage subsidy, helping people in terms of tax obligations, forbearance obligations, forgiving, and so on. But also, in fact, in this situation, which was also seen during the Great Recession, we're going to need money divested towards work retraining, because many of these jobs, especially the face-to-face economy, those jobs are not coming back after this COVID situation is finished. But your question is critical. How do we handle this as we're quarantined? Well, part of this relates to security. And what we're learning about the relationship between economics, employment, and suicide is there is a intermediate, and the intermediate is the person. And there's a difference between losing your job or losing your source of income versus not knowing if you'll get a job again and not knowing when the next dollar is going to come. So we witnessed in the last 2 weeks, University of Michigan's published some data showing that consumer sentiment confidence is going down. No surprise. What we can do is, and this is why I think it's important to have regular communication by public officials, federal, state, and municipal officials speaking frequently to the public about strategies, of course, presented in speak that we can all understand, that will provide income, provide money to pay the bills, provide income security. This is a critical thing that'll be helpful for us as we're sitting at home. Now, I call all those strategies social resiliency enhancement. Now, there's things that we can do for our general well-being. We should be sleeping well. We should try to get some exercise. We should be dieting better. We should, drinking alcohol in moderation. We see the numbers going way, way up and so on. And that's important for general well-being and security, and that all matters. But I do think that this is, at this stage, the societal input's going to be really, really important. By the way, I think it's important also to state, like many things in life, there's intention and then there's unintended consequence. And there was a wonderful analysis just published recently from MIT and the Federal Reserve showing that if you go back again to the Great Depression, back to the pandemic of 1918, which actually we always say it's 1918. It really was longer than 1918. It went actually through 1920. But the so-called Spanish flu or the influenza pandemic that took place in America, it was estimated that between 500 and 750,000 people lost their lives during that time. And this wonderful analysis that came out of MIT and the Federal Reserve showed recently that those cities in the United States during that pandemic that had the earliest and most aggressive social distancing, social isolation, stay-at-home orders, not only had the lowest mortality, but had the fastest and most robust economic rebound. So quarantine has a positive intention. It spares us from exposure to the virus, but it could have implications for getting the economy back faster. But there's unintended consequence. And the longer this goes on, the greater you're going to see economic insecurity, job insecurity, and that's what leads to suicide. And in our analysis, that's exactly what we found.
I want to get you to speak on one thing, because I know aside from being a professor of psychiatry, you're also a professor of pharmacology. And I've been advising people, against drinking. There was even people saying, oh, if drinking heavily will help you not get COVID-19 or whatever. But as I understand it, it actually impairs the immune system. Can you just comment on that briefly?
That's correct. And, this has been a very difficult issue for states and other jurisdictions to manage. What is an essential service? And is alcohol an essential service, an essential product? And this is, a discussion that is probably going to have to be reflected on much more deeply after this crisis is done. Alcohol is an immunosuppressant. It is bad for the immune system. Moreover, people who drink alcohol often engage in other behaviors that further adversely affect their immune system. For example, smoke cigarettes and so on and so on. You probably know that in the US and in the UK, in the last 4 weeks, there's been about a 50 to 75% increase in some reports of alcohol purchasing at the retail level. So very concerning that we're seeing that. And when you go back to the literature again, history has lesson, what we've learned from previous recessions, previous economic recessions, is that you do see an increase in alcohol, especially binge alcohol, so this impulsive alcohol drinking, and that's associated with suicide. And so I think it's important that people drink in moderation, and so on. But it's interesting because many public officials have been asked recently, what's the rationale for allowing people to buy alcohol? And some states have kind of had mixed messages on this, but some people have said, well, the reason is because we have people in our population who abuse alcohol, and if it's not available to them, that would precipitate a withdrawal. And that would then require an emergency room visit, which could take up a bed that we need for COVID 19. That's a fairly linear way of connecting dots. Um, Certainly, I appreciate that there is a delicate um, managing act politically when it comes to this issue. But certainly, nowhere in my medical training did I learn that for people who abuse alcohol and have a serious alcohol-related problem, that the provision of whiskey is actually the ideal treatment. I didn't learn that in my training. So I think we need to be, and I'm being a little bit facetious at one level, but at other level, I think we have to be very careful. And I think that, maybe a bit of, frankness on the topic. If government is indeed wishing to facilitate the access, not to precipitate withdrawal, to utilize hospital services, well, then it would seem to me then that we should also at the same time be providing support services for people who abuse alcohol. That makes sense to me. So but the short answer is alcohol is an immunosuppressant.
So I want to jump back for a moment to the need for communication that you talked about earlier as one of these kind of early what to do mitigation strategies. Now, are you imagining that the President of the United States, and he's doing these briefings pretty much every evening these days? How would that look like? How could people feel more secure in these indicators that are becoming that you're seeing are becoming an issue?
Well, I think that what I'm hearing with as you said, almost daily reports from the task force, the White House task force on the coronavirus, in my view, they are touching on key aspects that I think address some of the areas of concern. I'm hearing comments around the provision of funding, immediate funding, not just to people, but small businesses. People say small business is the engine of the economy. That's true. It's also a vaccine against mental illness. Because going to work is not just a paycheck. Going to work is really, it's your support network. It's often your only support network. It's your identity. It's your structure. So I think hearing that and hearing it almost every single day, I think is great. I'm also hearing about how the funding is being made available vis-a-vis employment, unemployment, as well as, in fact, funding available for larger corporations as well. So what I'm hearing is, in fact, really, really important. What I've been really pleased to hear during these White House Task Force press conferences is speaking about suicide, speaking about depression. And I'm actually, frankly, genuinely perplexed why we don't hear this more. And I'm so pleased that that's being spoken to, because people sitting at home are distressed and insecure. And if they hear their leaders say, look, we're going to have money available, give us your bank account, we're going to try and get it to you tomorrow, we're going to try and speak to your employer, your local sandwich shop, your local grocery store, we're going to help them. And we're also, in fact, recognizing that suicidality and depression and alcohol is a serious issue, and we want to end this as soon as possible. I think that is all the check marks, and I've been very pleased to hear that. What I'm especially pleased to hear is an exit strategy. And for reasons I'm not clear about this. I don't hear as many public officials in other countries, including Canada, talking about the exit strategy. You can, in fact, it's a false choice. Isolation versus getting the economy back. That's a false choice. And this is, in fact, what you started off with. We don't want the cure to be worse than the disease. And what's especially concerning is something that I think really dovetails into what I started off with, that be the economic, and how long this is going to go on for. Now, if we had 10 economists on the show today, we'd get probably 20 opinions as to what's going to happen with the economy in the next 2-3 years. So point is, we don't have agreement. And last time I checked, no one can predict the future. But what we are seeing is a consensus that the notion we're going to see a V, that is our immediate rebound, that doesn't seem likely. What seems more likely is it's going to be a W or a U And it's going to take a little while to come back. Now, of course, who knows? But I think what the gist of this is, it's going to take a while. And I'm just, sometimes you can, academics are very good at getting lost in all the theory. Sometimes you just have to be concrete. And that is, how confident will you be going to the movies, 2 months from now, or sitting in economy class, flying with, all your pals all squeezed in there in the back? I think common sense has to prevail. People are not going to be confident doing that. And I think, in fact, it's reasonable that the consumer sentiment is going to be adversely affected for a while. The other part is, this was a interesting assault on the economy because this assaulted the supply side immediately. Businesses shut down, and that's going to eventually affect the demand side. And that's quite opposite to what happened during the Great Recession, where the demand side was immediately affected. My point is that the demand side of the economy is going to be slower to warm up here. And that comes back to the individual. They're thinking, aha, I've lost my job. I might lose my job. In fact, how am I going to pay my bills? I've just signed up for a mortgage. How am I going to do this? And this is going to go on for a while, is my point. And so I'm pleased to hear that the White House Task Force is speaking to the key social interventions that were shown through the Great Recession and the Great Depression to be protective. As well, they're speaking to the distress that people are experiencing. And they're also speaking about an exit strategy. And I know that the political officials are being hammered on whether or not this is safe to do. Is it safe to be talking about an exit strategy? And what I find so interesting about the question is that the question is missing the point. We need an exit strategy because the brain does not react well to uncertainty. So whether the exit strategy is April 10th or 20th or 30th or May 15th, those are details. We need an exit strategy. And for some reason, discussion of the exit strategy seems to become taboo. I'm not even sure why that is. And it's so critical for the mental health and for suicide and distress related to this event.
That's incredibly fascinating. I've never heard this perspective before, but incredibly valuable, and I suppose helps inform a little bit of the strategy, maybe behind what's going on in the administration.
Yeah, I know there's a lot of different polls and so on. What the White House is trying to do. I don't think that the president's job is one that one would ever envy. But I think as a leader, what you need to do is you need to provide hope. As a leader, you need to surround yourself with people who have expertise in the decisions. And I'm seeing that. And as a leader, you need to speak to the person's experience. And the person's experience, not people who work on Wall Street, not people who've got the jobs of the higher socioeconomics. They're just fine. They're at home right now playing with their kids on games and everything. Life is fine. Their bills are paid. It's the face-to-face economy. People on the lower end of the socioeconomic strata, they don't have the privilege of staying at home. And they're distressed, and many of them have lost their jobs. And the leader should speak to that experience. And I think, in fact, that's what we're seeing from this task force. And I've been very pleased by it. Now, I know that people are debating some of the details and so on, but that's not the point. The human experience needs structure, it needs certainty, and it needs safety. And safety, yes, safety from infection and immediate harm, but also financial safety, employment safety. And we need safety for the future. And I've been hearing at least the effort to speak to that from this task force.
So, Dr. McIntyre, this is incredibly interesting, certainly offering a different perspective than I'd been considering. One thing I'm wondering if you could clarify is this supply and demand side of the economy. Like, tell it to me like I'm 5, because some of us might not get that.
Well, we all know capitalism rests on the seesaw of supply and demand. And we know that there needs to be the balance of the two for the economy to thrive and do well. And in simple language, what took place during COVID-19 is companies and various agencies were told to shut down by government law. They had to shut down. So look at manufacturing or whatever, retail and so on, they had to shut down. So the supply of goods immediately stopped. That's called the supply assault. Now, in the short term, people, they still have these their savings from the last paycheck, which unfortunately is not a lot, and they're hearing from the government, "We're going to take care of you. We're going to take care of you." Of course, that can't go on forever. So people have enough to make the bills over the next couple of weeks or so. But let's say, in fact, the government gives the green light for all the companies to open next week. Well, what will happen is people will go out and they will demand goods, et cetera, often very essential goods. But because of the fact they've lost their jobs, they're now going to be in a position where they're not going to be able to demand the goods as much. And because many of these jobs have been lost, these are jobs that have been lost, they're not coming back. The time to recovery of the demand side is going to take quite a bit of time. Again, I don't know how this is going to be, but I find it hard to believe this will be a V return in the economy. I think it's going to be a longer time for the consumer to come back. And this is different than the Great Recession, because in the Great Recession, because of the mortgage situation that took place, the loss of personal wealth because of the value of their home being lost, et cetera, that resulted in people losing a lot of money. So there was a demand side that was the first part to that at that time. So here in this situation, we have this uh, supply side that was immediately assaulted, and then we have the demand side, which is going to be assaulted over the next little while as people get back. Now, one point of reassurance, and we've been hearing this over and over and over again uh, from economists and some of the business experts, is that there's a lot of liquidity out there. Said differently, there's a lot of cash. There's a lot of cash, and this wasn't a structural problem that led to this collapse in the economy. This was a government shutdown of everything because of the virus. Companies still are sitting on a lot of liquidity, and there's a lot of liquidity available. So many experts in the area believe that companies will get up and going right away, and there's liquidity to help them. That does not, however, speak to the demand side. And when you lose jobs, most of the economy is consumer driven. It's a demand economy. And if that has lost confidence, either because people don't feel good about it or literally they don't have any money, that can't keep it going. And that'll spread the recession longer, and it'll also continue to hazardously affect well-being, notably suicide statistics, depression, alcohol, and also trauma-related disorders.
So, you talked a little bit with me when we were speaking offline about some of the successful, what you call mitigation strategies following the Great Recession in '08 and '09 in some European countries. Some of them were better off subsequently faster, some of them were less well off. Can you speak to that a little bit?
Sure. And Europe is a great, as I said, laboratory to look at this because the economies of Europe are disparate, not just with respect to the size of the economy, but the political structures. Some of these countries are older, some of them are not as old. And we can look at Europe maybe in two different ways. So you can look at those countries in Europe that are known for the percentage of GDP that goes to social programs. So more liberal type governments. People think about Scandinavian countries, Finland, Norway, Sweden, there's others, of course, but those are the ones we always think about as the exemplars. And then other countries went with more of an austerity approach post Great Recession. And we think about countries like Greece and a few others, even Italy, and this sort of unaffectionate acronym, the PIGS: Portugal, Italy, Greece, and Spain. And when you actually look at the trajectory, because again, data are data and the data are pretty clear on this, what was observed is that in those economies in Europe, post Great Recession, so we're talking now 2009, 10, 11, 12, those economies that spent more, that is, they spent more as a percentage of their GDP on programs like work retraining in the labor market, getting people to be retrained for other jobs, providing health services, expanding mental health service opportunities. Instead of a 6-month, extended to 1 year employment insurance eligibility, providing bridge funding for businesses, small businesses, and I can keep going. Those types of provisions in those countries that I mentioned significantly associated with a decrease in suicide. And what's interesting about this, and what I think is so compelling, is that in those countries that did that spending, that reduction, that mitigation of suicide did not always go hand in hand with a decrease in unemployment. Remember, we talked about the 1% rule. A 1% increase in unemployment in the US, Canada, and Europe was met with a 1% increase proportionately in suicide. In the countries in Europe that spent more money on these social programs, they were able to some degree, reduce unemployment, but the decrease in suicide far exceeded what would have been expected by the reduction in unemployment. Other countries, for example, the unaffectionate acronym that I mentioned, Portugal, Italy, Greece, and Spain, these countries continued until now to have staggering unemployment rates and very high suicide rates that continue to be very, very high in many of these countries. So I think that is empirical evidence. And again, this extends into Japan around the Great Recession. It was also seen, that is, as they increased the spending, the Shinzo Abe government post-Great Recession on some of these programs that I mentioned, there was a commensurate decrease in suicide in Japan. So we can conclude that it does work. In other words, we can conclude that if the spending is thoughtful and the spending is targeting mental health, resiliency, employment, and finances, that translates into a decrease in suicide. And those lessons, I think, can be brought here. Some people, interestingly, have said to me over the years, well, how does that really then explain the USA? Because the USA during the Great Recession saw this massive increase in unemployment, about 4% increase. We called it massive back then. That seems puny now. But a 4% increase in unemployment. We saw a 3 to 4% increase in suicide in some states more than others. But what happened in the United States is the economy got better, unemployment went down, but the suicide rate kept going up. And that probably speaks to other aspects that confound the model. That being the opioid epidemic, which has ravaged America the last decade. That's a big, big issue. Probably wealth inequality is probably speaking to some of this as well. And then thirdly, what's different about America versus other countries is that 50% of all suicides in the US are committed with a gun. So perhaps we didn't have in the US sufficient policies and procedures in place around gun, protections around guns. In other words, people could sell guns, but measures in place to the extent that they can to, reduce the risk with guns in their possessions.
It's really interesting. You mentioned that the people that are in the lower socioeconomic sphere are disproportionately affected by basically the stopping of the economies, so to speak. There's also a lot of literature now suggesting that similarly, they're also more affected by actually getting COVID-19. And there's certain demographic groups, and that certainly correlates, or at least from what I've read. And I'm wondering if you could just, speak to that. I'm sure you've seen some of this.
History has shown over and over again that whenever there's an economic crisis and whenever there are pandemics, some groups are affected more than others. And consistently, what we see is we see people who are of lower socioeconomic advantage, people who have mental illness, as well as people who are either immigrant and or certain racial groups. And again, these are not mutually exclusive. These can overlap, obviously. So to your point, we are hearing, for example, in the state of Louisiana, that the mortality rate due to COVID is higher, significantly higher than many other states we're being told. And the observation that African-American individuals are more susceptible to mortality from COVID is perhaps in part due to the fact that population is also more likely to have overweight obesity, or to have diabetes type 2, or to have cardiovascular disease, or also to smoke cigarettes. And all of this can be contributing because, the inability to breathe is a major risk factor for people for mortality and complications from COVID. Everything that I just mentioned, that is some of these non-communicable diseases, heart disease, obesity, diabetes, as well as the behavior of smoking, is also the case for people with chronic mental illness. So 40% of all cigarettes smoked in the United States, 40% approximately, are smoked by someone who has a mental illness. And so when we think about the mentally ill, they are more likely to have conditions that put them at risk of COVID complications. They also are more likely to be economically impoverished and to have housing insecurity, and also less likely to have sufficient supports in place to help them, interpersonal supports, et cetera. So, and again, this would extend into our immigrant population. So there's no question that these factors are being observed. No surprise, this is always observed, where the lower socioeconomic, the mentally ill, and immigrants, these are different populations, but there's some degree of overlap in that Venn diagram. These folks are often affected. That segues into something that I think we need to be very cautious about. When you look at the Gini correlation, the Gini index, so the Gini index we know is a measure of income inequality. And we know the Gini index, and really a score of 0 on the Gini index means that there's no inequality at all. Everyone's even when it comes to the wealth distribution. A score of 1 means that one person or one group has all the money and everyone else has nothing. So when you look across the wealthy OECD nations, 36 nations of the OECD, most of these countries come in somewhere between 0.2 to 0.6. The country that probably has the highest reported Gini number is often South Africa, about 0.7, meaning wealth inequality extreme. But the point I want to get at is if we think about wealth distribution in America, Canada, and other OECD nations and globally, we have empirical evidence to show that there has in fact been a distribution that has not been proportionate. And whenever you have a crisis of this magnitude, which in many governments become very much bigger after crises like this, that's one consequence of these types of situations, bigger government. But one other consequence of something like this we need to be cautious about is that this doesn't amplify, or this doesn't really make the gap between the haves and have-nots even greater. Because again, people who are in the brain capital economy, people who are in the finance, science, technologies, math, folks who have those types of positions are not as nearly affected as people who are in other positions that the face-to-face economy, retail, and so on, manufacturing, and then that could potentially amplify. So we have examples of further wealth inequality, and that not only has implications for the well-being of our citizens, but it also has implications for democracy, because the literature is clear that the greater the wealth inequality, the more it undermines democracy.
That's fascinating. So you're suggesting that there should be some kind of, I hate to use this word, stimulus, because it usually means throwing $1 trillion at something, right? But I'm going to use it, basically stimulating manufacturing and these kind of core industries or the face-to-face economy somehow that are disproportionately affected?
I do, and you're right. Words matter, and the word stimulus has a valence to it that gives people indigestion. But I would say it this way, that this is a different situation. I take the view, and this is my view, and I know that many share this view, that if there's been malfeasance, if there's been inappropriate behavior that a company has done, and now they're in financial distress, I don't believe in the privatization of the profit with the socialization of all their problems. I don't think that's a fair deal. I think corporations should enjoy the profits they deserve, but should not be actually asking the taxpayer to pay for their nonsense. This is not what happened here. This is not what happened. This is, in fact, the economy was doing wonderfully. The economy was doing very well. on the statistics that we define it on, we know that there are some groups that are clearly not doing as well. But on the macro numbers, the economy was doing very, very well. The government, by law, shut them down. And these corporations, yes, they're making a profit, but they're also putting money into the 401ks for people. They're also keeping people, giving people jobs, which is good for their mental health. So I don't like the word stimulus either. I'm not sure I have the right vocabulary to replace that very radioactive word with something more perhaps neutral. But I think some type of bridge, or whatever that word is, or maybe that is the word, some type of bridging to get them the doors back open again, to me makes good sense. And I don't think that's socialism. I don't think that is, against, the guiding principles of capitalism. I think that this is really, in fact, warranted given what's happened.
Okay, so let's talk a little bit about what you can do at home. So, there's a ton of us. In a sense, I'm lucky because I'm in an essential industry. You are too.
Yeah.
And so I'm working. In fact, I have more work, if anything, the last while because there's so much that we need to be reporting on at this time. A ton of us are not in this situation as we've just described. What is it that, if we're in that kind of a situation, what should we be doing at home? Some people have put their hearts. I was just talking with a good friend of mine who put her whole heart into suddenly discovering the concept of homeschooling, and basically, she's very busy now,
Yeah,
as,
no
as are
doubt, no
as are
doubt.
many parents. But again, that's not everyone's situation, and what is it that you recommend for people to be doing in these situations?
Yeah. I think that first of all, we're talking about the difference between how these types of stressors affect different parts of our society. And there is a part of our society that will take a disproportionate weight. That's not to imply that people who have high paying jobs and are, and so on, that they're not also under stress. I mean, these are people and they have their lives to live. So I think the first job of the day is take care of your own health and take care of your family's health. And that's essential. And for many people, they're so darn successful because they work all the time. And this is also very difficult for them. And this is a significant adjustment. And they'll need to, in fact, adapt. As if you don't adapt, you're going to maladapt. But I do think, in fact, it's an interesting time because people are discovering for the very first time that they have neighbors. They're discovering for the first time there is a house that's next door to their house, and I think, in fact, that it is true that if you have major bankruptcy, if you have major loss of consumer confidence, if you have major loss of consumer sentiment as a consequence of something like this, everybody loses. Everyone loses, not just from an economic perspective. Capitalism takes a hit, and obviously society takes a hit. So I think I've been really inspired, frankly, by what I'm seeing. I'm seeing a lot of private-public partnerships that have unfolded. This takes leadership in the corporate sector with different organizations, not just providing, N95 masks and PPE and things of that. That's wonderful when we need that. But also, in fact, being very thoughtful around, taking care of people, of course, respecting laws of social distancing and et cetera. And I think to the extent possible, I think to the extent to which people can involve themselves in a broader social mission. And I think that Jack Welch, he died recently, and he certainly was well known for his emphasis on profit, but also the emphasis on purpose. And I think those are not mutually exclusive. And I think this is a wonderful, wonderful time to be thinking about broader purpose and to take care and get involved with people. And I've been seeing all kinds of stories and hearing stories that people are doing just that. And I think that it's a win for all of us. And I've been, frankly, been quite impressed at how much I've been seeing this, corporations working together and also working with the public sector. And for the most part, partisanship has been put aside and we're all working together. So I think that is in the world that I work in psychiatry, there's been many great emissaries who have talked about fulfillment in life and the generativity and the sense of accomplishment you have when you fulfill. In materialistic acquisition and conspicuous consumption is certainly very validating. Doesn't often lead to fulfillment. Some it does, but doesn't often. And it's these types of contributions that can actually, for many people, add to the sense of fulfillment along with other pursuits in their life.
So, Dr. McIntyre, you mentioned that there's you're seeing a bit of a, I guess, reduction of partisanship or polarization. I have to say, where I stand in the media, looking at the Beltway, looking at DC, in New York, I'm not looking at my Twitter feed, daily. I'm not really seeing that.
Well, I think that when I speak to that reduction in partisanship, I'm referring to what the stimulus agreement that took place, and there was wide agreement on that. I'm also a pharmacologist. We talk about half-lives. I don't think the half-life is going to be very long for this in terms of the goodwill. We're probably going to see a resurgence of the partisanship. I think it's still there. I don't think it's completely, abrogated at all. And we're going to see it, and that's unfortunate because I actually think, frankly, that some of that partisanship is getting in the way of some of the public policy. And what I mean by that is, we've been talking about how important it is to quarantine for a finite period of time with an exit strategy. It's also important to emphasize exit strategy and getting people back to work. And, in passing, I mentioned that work is a vaccine. It is a vaccine. Work builds resiliency against mental illness. The literature is clear on that. It's not a concept. And for reasons unclear to me, which I think is because of partisanship, is my working hypothesis, that's not coming into the conversation. Somehow this false choice, either you have to believe in the health of Americans or believe in the economy. And that makes no sense to me. And I think that is a rhetoric that reflects the partisanship, but those are clearly really, they have to go together. And so I do think the partisanship is still there. We saw a little reprieve for a while with that vote that passed the stimulus. I do think it's still there, and I think it's affecting this discourse, and I think it's adversely affecting the discourse. And I would like to see the exit strategy. I would like to see specifics on how this economy is going to be protected, and I want to see specifics how the mental health is going to be protected. And that conversation seems to be either not taking place or strangulated with accusations, and this is what takes place: accusations that you don't care about people. Well, again, that's a false really conversation. So I think it's still there, but I would have hoped that some goodwill would have continued, but unfortunately, I'm not so confident it will.
So, should I be studying my Twitter as much as I do? I'm asking this because of, some of the literature you and I talked about earlier, and, tell me what you think about that.
Well, I think that when it comes to human being during a time of quarantine and social distancing, you want to connect. It's called being a human being. And you want to have information. We learned from the SARS epidemic, accurate information reduces anxiety. But like most things in life, you have to have moderation to this, because we found in research we did in China recently in the last 1 month that the more time you spend on social media, the more likely you're going to be reporting yourself as depressed and anxious and stressed out and having a very negative quality of life. And this isn't just some outlier study. There is a highly replicated findings showing that, this is before COVID, that the more time you spend on social media, the more likely you're going to report all of the things I just mentioned, all these negative outcomes, as well as more likely to report yourself as lonely. We've had a loneliness epidemic going on for a long, long time in Europe, in North America, and as well as in Asia. So people often say to me, well, wouldn't it be the case the other way around? Isn't that people who are more anxious or perhaps more stressed or feel more lonely, don't they go on social media more? Well, there's ways that we can look at that, and I won't get into all the details of all that. But the direction seems to be that a moderate exposure to most things in life is probably what's best, including social media. But people at the extreme, 3, 4, 5 hours a day on social media, they definitely begin to report downturn in their well-being, downturn in their overall positive outlook of life, and absolutely become more likely to report negative expectations of their life and their future.
I hope everyone that's watching, makes a point of listening to this, because I imagine, most of us are spending more time than normal on social media. So, such valuable information. We're actually going to finish up in a moment. Any final words before we do?
We've been hearing a lot about flattening the curves, and we need to flatten curves as soon as possible. We also need to prevent curves. And what I mean by preventing curves is not only the return of the virus, but the emergence of suicide and the emergence of conditions that are highly associated with suicide, like depression and like alcohol-related problems. Secondly, we've had experience going not way back in the recent years where we've been able to learn that directed funding to build social resiliency, like you and I talked about, really benefits our citizens and reduces some of these complications that I've talked about. Where we go from here is as follows. We not only need a biomedical approach to this virus, we need to have an economic strategy, a work strategy, and a mental health strategy, and that all goes together. We're seeing hints of it, but if we can instantiate it, I think we can mitigate some of these awful projections of suicide that my study is suggesting is going to come out of this COVID situation.
Right. And, have all these strategies and also communicate them effectively. That's what I'm hearing. Such a pleasure to speak with you today, Dr. McIntyre.
Thank you for having me.